Good afternoon, everyone. My name is Köves-Dobszai, and I work in PH as a clinical trial manager. And as a PhD student, my vision is aiding physicians in risk assessment and decision-making about patients with obesity. And to be able to do that, our mission is to comprehensively address all factors related to obesity for deeper understanding the way they interact with each other. We have already conducted a meta-analysis that investigated the effect of body mass index on the outcome of acute pancreatitis. And as a continuation of our earlier research work, we took other related factors into consideration. And now we are investigating the effect of metabolic syndrome factors in an updated meta-analysis. In my second project, I will be investigating the same for metabolic syndrome factors, but in this case, we are conducting a registry analysis and we are investigating patients with COVID infection. Let me introduce my first project that is investigating the effect of metabolic syndrome factors on the outcome of acute pancreatitis. As you all know, the mortality rate of acute pancreatitis can even reach 50% in the severe form of the disease. And as obesity rates are increasing, so does the prevalence of metabolic syndrome, especially in the Western countries. Earlier studies have associated metabolic syndrome factors with a more severe acute pancreatitis outcome and even higher healthcare costs. And it may seem like we have sufficient evidence in this field. However, these earlier studies were either meta-analyses focusing on only one of these factors or cohort studies with low sample sizes. So our aim is to analyze the individual and synergistic effect of metabolic syndrome factors on the outcome of acute pancreatitis. Our clinical question was how metabolic syndrome factors affect the outcome of acute pancreatitis, and the four exposures that we were investigating were obesity, diabetes, hypertension, hypertriglyceridemia, and we wanted to see how they affect mortality, severity, and the rate of complications. We have conducted a systematic search in 3 databases, and from almost 20,000 articles, we could include 86 in our final analysis. We have finished the analysis on metabolic syndrome and 3 of its components, while the rest of the analysis on obesity, including body mass index, waist circumference, and even visceral adipose tissue, is still ongoing. So as you all know, one of the most important outcomes of acute pancreatitis is disease severity, which is considered mild if the patient does not develop any complications or organ failure. It is considered moderately severe if the patient has developed some complications or an organ failure that resolves within 48 hours, and the disease is classified severe if the patient has a persistent one or multi-organ failure. In our analysis, we included both prospective and retrospective observational studies, and there is an overall high heterogeneity among the studies, which is partly due to the fact that the included articles used a slightly different definition for metabolic syndrome, and there is a huge difference in the types and numbers of centers in the included articles. So our first forest plot shows that metabolic syndrome patients have an almost 40% increased risk for severe acute pancreatitis outcome. And however, this result can be considered clinically relevant. This is not significant statistically. Secondly, we investigated the effect of METs on the mortality of acute pancreatitis, and as you can see, 2 of the included articles did find an association, while 2 of them did not. And the reason behind not getting an exact answer in this case is mostly due to the very low number of events in all of the articles. However, when investigating hypertension individually, we did find a statistically significant result, and we saw that hypertensive patients have an almost 2 times higher risk for a severe and almost 3 times increased risk for a fatal outcome in acute pancreatitis. The effect of diabetes on the acute pancreatitis severity is also statistically significant. However, while the point estimate indicates an association between diabetes and mortality risk too, in this case it was mathematically not significant. We also investigated patients who presented with an elevated triglyceride level on admission but did not meet the criteria of a hypertriglyceridemia-induced acute pancreatitis. And we saw that a borderline elevated triglyceride level means an almost 3 times increased risk for severe acute pancreatitis and a 2 times increased risk for fatal outcome in AP. The strength of our analysis is that this is the first comprehensive meta-analysis in the field, and we applied a transparent methodology and analyzed the metabolic syndrome factors individually also. However, there is a high heterogeneity among the articles, and the sample sizes in the subgroups are quite low. Our preliminary conclusion at this point is that metabolic syndrome and its components seem to worsen the outcome of AP, and they may serve as a clinical predictor for severity and mortality. The implication for practice would be that metabolic syndrome patients require closer monitoring, and lifestyle counseling and education of patients with obesity is also crucially important. However, the accuracy of other body composition parameters rather than BMI in prognostic scoring and risk assessment is to be investigated further. For this first project, I am still waiting for the rest of the statistical analysis, but meanwhile I am working on the manuscript for which I have written the methods part, created most of the supplementary figures, and started drafting the results. In my second project, I am investigating the effect of metabolic syndrome factors on the outcome of COVID infection. So the mortality rate of COVID infection were between 3 and 7%, and its clinical spectrum ranges from an asymptomatic infection to mild respiratory tract symptoms to even severe pneumonia and multi-organ failure. And earlier studies showed that comorbidities cause a more severe outcome and poorer prognosis. And as I earlier mentioned, metabolic syndrome factors are major risk factors in a number of other diseases. So our aim with this project is to do the first comprehensive analysis on the combined and synergistic effects of these factors on the outcome of COVID infection. Our clinical question is how metabolic syndrome factors influence the outcome of COVID infection, and we are looking at the same 4 exposures as in the first project, and we would like to see how they affect ICU admission, the need for mechanical ventilation, disease severity, and mortality. And we hypothesize that the more from the 4 metabolic syndrome factors are present, the worse the progression and outcome of the infection will be. And with this analysis, we are hoping to improve the risk assessment and prognostic scoring of these patients. For this analysis, I use the same registry that Luca has already described. And for my second project, we have done the preliminary data retrieval plan, cleaned the data table, and currently I am in the process of collecting some additional data from the medical records to determine the group of patients who had pre-existing hyperlipidemia based on the regularly taken medications. However, we did some preliminary analysis on the other 4 investigated exposures, and we saw that the rate of severe and critical outcomes were higher in all 3 of the case groups. However, mortality was only increased by hypertension and diabetes, and not obesity individually. So to sum up, I still have 2 ongoing projects, and I hope to submit both of the articles by the end of this year. Thank you for your attention, and I would like to close my talk with the words of Abraham Lincoln. Things may come to those who wait, but only the things left by those who hustle. Thank you very much.
Congratulations for the very good and excellent presentation. Any questions from the floor?
Have you examined the role of fatty liver as a risk factor because it's suspected to be the part of the metabolic syndrome, or do you have any information?
We haven't investigated that, but this is a good idea to incorporate. Thank you very much for the suggestion.
Congratulations for the nice presentation. Why would hypertension increase the I see that it does, but is there any theory like why hypertension increases the mortality of, or severity and mortality of acute pancreatitis? From the literature, is there any suggestion?
I haven't really dealt with that yet, but before starting to rewrite the article, this is something that I have to go after. So thank you for your question.
Thank you.
Increasing number of the risk factors of the metabolic syndrome could increase the risk of other disease, morbidity, mortality. So maybe you can examine the increasing numbers of the metabolic syndrome, not just alone one metabolic factor role. Understand that in the future.
Okay, thank you very much. Thank you for your suggestion.